Hi, I'm Dr. Bhargav Rao from Pathofast lab in Pune. If you have problems like facial hair, menstrual irregularities, or acne or zits, then your doctor may have recommended the Androstenedione blood test. And today I'm going to tell you everything about this test. So what is androstenedione? Androstenedione is basically a steroid hormone precursor. Now what does that mean? Above each of your kidneys there is a tiny gland called the adrenal gland. There's one on each side, and these are the glands that produce the steroid hormones. Now the steroid hormones are the ones that go on and later get converted into things like testosterone and estrogen. But while these hormones are being made, there are several sub steps or steps along the way, and at each step a different hormone is created. Androstenedione is one of these hormones that is created along the way. What are some of the symptoms that you may be having which can give us a clue that there's something wrong with your androstenedione hormone level or that you need this test? So the first one is called hirsutism, where you develop facial hair, especially in women. This is hair above the lips, below the chin, on the arms, on the back, upper chest, as well as on the thighs and the arms. This hair is abnormal and it is called hirsutism. The second is acne. This is very common. You will develop acne all over your face and maybe even on your back. The third is menstrual irregularities, where your cycles become irregular. Sometimes you miss your period completely, or you may have periods without ovulation. The next is infertility. You're not able to conceive with your partner. The next is male pattern baldness, where you lose hair from the top of your head or from the crown of your scalp. This is very common when there are too many androgens like androstenedione in your blood. The next is a deepening of your voice. You will develop a hoarse or a deep voice. You may also have symptoms like muscle weakness. You feel very tired, as well as fatigue. Why would a doctor have ordered an androstenedione test? What does your doctor suspect that you might be having, because of which they asked you to do this test? So there are 3 to 4 different conditions which can be diagnosed if there is something wrong with your androstenedione levels. The first one is PCOS, the most common one in women, polycystic ovarian syndrome, where there is too much of male androgens in a woman's blood, which causes the symptoms like menstrual irregularities, infertility, acne, facial hair, weight gain, and so on. The second one is a disorder of your adrenal gland itself. Sometimes these adrenal glands, they become large in size, or they produce too many hormones, and one of the ways to check for this is by doing this test. The next is sometimes there is a cancer or a tumor in the adrenal glands which starts producing too many of these steroid hormones, and this is one of the ways by which we can check that. And there is a condition called congenital adrenal hyperplasia, in which your adrenal glands become large and they start producing a lot of these hormones. So we can also monitor that condition by checking the level of this androstenedione hormone. How is this androstenedione test done? Well, the androstenedione test is a simple blood test. All you need to do is provide a sample of your blood in the lab or in the hospital. They'll insert a little needle into your vein, draw a couple of ml of blood, and process it in the lab. Do you need to have any special preparation for this test? Not really. You don't need to be fasting for this test. We usually recommend that the test should be done in the morning between 7 to 9 a.m. In women, this should be done during the follicular phase of your cycle. And some medicines that could affect the results of this test are if you're already taking corticosteroids or any kind of supplements which could affect the androgens in your blood, then you should tell your lab or your doctor that you're on those, because they can affect the results. What are the normal ranges of the androstenedione blood test? I've included a list of the normal ranges on this page. You can just go through the ranges. As you can see that the ranges depend on your age, as well as whether you're premenopausal, whether you've already had menopause in case of women. So you can take a look at the different ranges that are mentioned on this page. These are the established normal ranges for this test. What do the results of the androstenedione blood test mean? Higher than normal values are the ones that we are actually concerned about, and here is a list of the reasons because of which your value may be above normal. The first and most common cause is the polycystic ovarian syndrome, where I've already mentioned that there are too many androgens in your blood which are causing all your symptoms. The second could be congenital adrenal hyperplasia, which is basically a condition in which your adrenal glands produce too many male sex hormones which give you all the problems. The next is cancers of the adrenal gland. There might be a cancer in your adrenal gland which is causing overproduction of these hormones. The next is called ACTH overstimulation, which is a condition in which your brain sends signals to your adrenal glands to produce too many of these hormones. And the last is there are several medications which could also cause this to happen. So these are the 5 reasons because of which you might develop an abnormal androstenedione level. You must of course consult your doctor. This is just a simple list.